the US spends $5 trillion a year on healthcare. That's $14,000 per person a year. A whole year of care for one child at BCP is under $3,000. Like, it is very, very inexpensive. And that includes your healthcare, that includes your backpack for school, your holiday gifts, that includes hygiene products and clothing at every visit and food at every visit. It's a very holistic view. And I think when you do it right and you do it well and you take out bureaucracy, it's actually inexpensive too.
Welcome to episode number 1 of the 2026 IVI Podcast, where I talk with innovators and visionaries making an impact. And I can't think of a better guest to kick off the new year than Robyn Riseberg, who is the founder of Boston Community Pediatrics, the first nonprofit pediatric private practice in Massachusetts, and one of the first of its kind in the United States. Robyn's story is one of deep conviction and perseverance, and it aligns perfectly with the focus of this podcast. So settle in and listen to how one person identified significant flaws within the Boston pediatric care industry and created a solution designed to not only improve the doctor-patient relationship, but to literally redefine what care looks like for Boston's underserved communities. It's an amazing story that I think everyone can learn from. Here we go. Robyn Riseberg, welcome to the IVI Podcast.
Thanks so much for having me.
It's great to have you on. I know you've been busy. How was the Voices from the Front Line?
Oh, it was amazing.
Yeah. Was that year
Like
3 that you,
5.
year
It was just
5? Wow.
the anniversary. Yep. So
This is the big fundraising event that you do every year for.
yeah, well, I mean, people say every year, but we've been open 5 and we've done 3
Oh, okay.
bigger-ish ones. And this was by far the biggest. We had almost 600 people there
Phenomenal.
and we raised a lot of money. So and the program was amazing. We had patients speak, a patient sing, we had staff speak, we had a video, like the energy in the room was incredible. It was really great.
Well, I'm sorry I missed it because I was out doing what, my favorite thing in the world is doing, was fundraising on my own for
Yeah.
Givinga. So I wasn't around, but I've been to that program in the past and it's just phenomenal. And I mean, 600 people showing up for that is just amazing. So congratulations on
Yeah, thank
for
you.
that.
Thanks. Yeah, it was great.
I've been looking forward to this one. This is an exciting one for me because, not only have I gotten to know Boston Community Pediatrics, I mean, I've gotten to know you as well. You've got an incredible story that I think the listening audience is really going to enjoy about not only what this is, but kind of how you got there and, what your vision was and how you kind of arrived at this very, very important thing that you're doing in the Boston community. So I'm super excited to talk through this with you. And I think that what I'd like to do is let's start before we go through the backstory. Maybe you spend a few minutes and just tell people what Boston Community Pediatrics is. What is it that you are doing? Where are you located? We'll get into the why here in a minute,
Yeah,
but I'd
no, that makes
like to
sense.
just kind of frame that at the beginning.
Yeah, so Boston Community Pediatrics is the first nonprofit pediatric private practice in Massachusetts and one of the first in the country. And we have been created to bring equity to pediatric healthcare. So essentially, we provide the highest quality pediatric primary care. So, like your well child visits, sick visits, vaccines, combined with integrated mental health services. So we have 2 full-time mental health clinicians who deliver care with the pediatrician. So we are going into therapy visits and they are coming into our visits. And then we have a whole team helping families with the social determinants of health. So housing insecurity, food insecurity, help with childcare, help with utility insecurity, education, early intervention, like anything that a family and a child needs to be healthy is what we do. And again, the same thing as with the mental health clinicians, we go into, they don't typically have visits, but when a family comes in and needs support, the pediatricians are there. And then when we're seeing patients and they are kind of flagging for us or talking about any concerns they have, we're going to bring a care navigator or family partner into our visit so that we can support families best and like they don't have to tell their story twice. And then we work together to really support the family. So it's a whole team approach to pediatric healthcare. It is really looking at the health of children and the health of communities and the health of families, as opposed to just healthcare in a silo, if that makes sense. And we have a broader vision of health, and we really do whatever, we center the patient in everything that we do and do whatever the patient and the family needs to be healthy, which, believe it or not, is sort of a unique view of health and healthcare.
No, I believe it. It is a unique view of health because, and I don't think that I'm the only one that would do this, but if you think about, oh, you're a pediatrician. Okay, I get that. So you're taking care of children. Okay, I get that. But what you just described is pediatrics at a whole different level. And I think that the description of taking care of almost the whole child, from not only their physical health, but their economic health, how their family is doing, just incorporating all of those things into that child's healthcare is extremely unique. Is there I'm assuming maybe there are organizations that are doing it like this, but I can't really think of one
Wow.
in Boston that's taken this approach.
Yeah, there's really only one other model that's pretty similar in the country that we're aware of, and that's in Colorado. We actually had the opportunity to go visit them. Um,
Oh,
and it's a pretty, it's a very cool model. It's a little bit, they serve like a wide range of patients all over the state, and it's been around a lot longer than us, but it is not as like high intensity with the work that we do with the family. So after being there, I would say like we're kind of really the only model like this in the country that I'm aware of.
okay. So, as you know, this is called the IVI Podcast, and we talk to innovators and visionaries making an impact. And once again, you might think that that's just, business people that we're talking to, but what you are doing is not only innovative, but you had a vision. And I'd like to walk through that vision and how it kind of started because, in us talking and me getting to know you, I think one of the things that really struck me is the pathway that you took just to becoming a physician in the first
Yeah.
place, right? I mean, it wasn't a foregone conclusion for you. And you had some very interesting circuitous kind of routes that you
Yeah.
took that led you back to Boston. And I thought, could we start there and talk a little bit about kind of what spurred this, what seeds got planted, where they were, how this thing started taking hold? Because this is exactly the type of organization that I enjoy, and you're exactly the type of person that I enjoy talking to because when I think about innovation, innovation is great, but without a North Star vision of what you want this thing that you're innovating to become, you can just kind of ramble around. And you've moved around a lot and you've seen a lot, but there's always been that core vision that's associated with that. So maybe take us back a few years and talk a little bit about how this thing got started in your mind.
Yeah, that's great. And I will just say as a North Star, it's taken me probably a year to be able to say this, but like we really have decided that we're trying to change pediatric healthcare because, and that is our North Star, to be able to provide this type of care to all children. Like I think everyone deserves this type of care. And our model is focused on kids with low income, but actually everyone would benefit from this type of care. And I think we need to like bring healthcare back to focus on the patient and where it needs to be. But I'm sure we'll get to that. So, I mean, there I could go way back. I'll give a little bit of a brief history. Both of my parents were very united in their focus on helping others when I grew up. And actually at our event, I just gave my parents an award, and a surprise award that they didn't know they were going to get, and talked about one of the kind of core things that they always taught me was to treat others the way you would want to be treated. And that really is something that I've always carried with me. And even in this model, when people say like, how do you decide what you do or how you do this, it's like, oh, how would I want my own family to get healthcare, my own kids to get healthcare? And that's the type of healthcare that we provide. But so I grew up going to kind of being exposed to many different people from all different backgrounds, many different organizations, and always wanted to give back. And that was very much kind of a part of my childhood and a part of, growing up with in the family I did. And then went to the University of Michigan for undergrad. I thought I was going to be a sports psychologist.
That's kind of
I
where you were focused initially, right?
Yeah.
You were moving
Yeah.
down that path. Yeah.
Exactly. I was a psychology major, which I love and I use it every day. And I think it's a great background actually for business as well and for healthcare and most things in life. And so I'm glad that I have that background, especially doing all of the kind of intensive mental health work that we all do together. And then during college, I went on semester at sea. I didn't go abroad to one place. I went on a large ship that went to 9 different countries around the world, and I fell in love with India. And after college, went back there and traveled around with a backpack for 6 months, going mostly in Southeast Asia. Spent a lot of time in India, and had this one day that I can still remember where I was in Delhi and there was so much poverty around me. And I thought, well, if I'm a sports psychologist, I can help a few people. But if I was a doctor or a pediatrician, I could help a lot of people. And,
Mm.
but I was afraid of blood. I never took a science class undergrad. So I was like, I got that's kind of a crazy thing to think about. So I put it
Right.
out of my mind
Right.
and almost really never talked to anyone about it and moved to New York City when I got back and was working at Planned Parenthood doing development fundraising for them, which again I now use in my job every day. And
Right. Right.
but realized I didn't really love working in an office and was at the same time volunteering in their clinics and I loved that work. And so I decided in order to, this is really fulfilling to me. I love working with people. I love kids. I think I'm going to go to med school. So I went
Okay. So
back and
the spark's created in India,
yeah,
right? Some of the background is created at Planned Parenthood.
yeah.
You don't like blood. And all of a sudden you decide now you've been kind of doing things for a few years now, right? This
Mhm.
is kind of into your career to some extent.
Yep,
Um, you then decide you're going to go back to medical school
yep.
because you got to fill that gap. You got to get a license and all of that. That must have been a pretty momentous, significant decision. I mean, that's pivot, right? Well,
Yeah.
it's not really a pivot, but it's a big jump into, this kind of direction that you were taking.
Yeah, no, it was a big jump. I had to leave New York City where I was living, apply to schools. I wanted to do it as quickly as possible because once I decided that I wanted to do this, I wanted to do it. And so Bryn Mawr College is one of the only places where you can get all of your pre-med science requirements done in one full calendar year. And so that was the place I
Okay.
applied. I was lucky enough to get in and go. And so I was able to go pretty quickly after I think I made the decision in June and I think I started like the end of August. So so it was
Okay.
probably quick enough that I didn't have time to really think about it, which was probably good. Although I have to say, when
Right.
I did decide, I talked to a lot of people and I was surprised at how many people said like, "Oh, that sounds kind of crazy and like a long, hard path. And are you sure you want to do that?" And there were kind of a lot of people out there that weren't as encouraging as I thought they would or should be. Um,
Naysayers. Yeah,
yeah,
we've all experienced the
yeah,
naysayers.
yes,
One thing I've learned about the naysayers is you can listen to them, right? But they are who they are, and
yeah.
you got to break through that and keep following what you believe. So
Yeah,
keep going.
clearly. Yeah. So after that I went to UMass Med School and was very focused on working with underserved communities. I was in a track for that specifically in med school, and I did a lot of advocacy work when I was in med school. I also knew that I wanted to work with mostly probably Spanish speaking communities. So I learned Spanish. So right before I went to med school, I got on a plane to go to Ecuador because I heard that they speak the slowest there and it's the easiest to learn Spanish there. Got on a plane by myself and lived with a family in Ecuador trying to learn Spanish right before going to med school. So it
Was
was
that
all,
actually true?
yeah.
Was it true? Did
Yeah,
did
they do
do
speak
they speak
slower.
slower?
Yeah,
They
because I like,
Wow,
for
that's
instance,
incredible.
I take care of a lot of Puerto Rican and Dominican patients now, and they
Right.
speak
Yeah.
so fast. So,
Right.
it is true that, the Ecuadorians speak the slowest, and it is, I think, the easiest to learn there.
Well, I think I'll preface this. What the audience is going to hear is if there's a phrase that I can attribute to you, it's attention to detail, and
Yeah.
that's a perfect example of your attention to detail. I mean, I would never even thought about that, but anyway, keep keep
Yeah.
going.
Um, so then anyways, I finished med school and did my residency at Boston Children's Hospital and Boston Medical Center, again, in pediatrics. I went to medical school thinking I wanted to be a pediatrician. I actually, like, loved every rotation I did, except for psychiatry, interestingly. But
Oh, that's
but I
funny.
loved surgery, I loved family medicine, I really, like, I loved OB, I loved all of it, but ultimately thought, like, "What do I want my day-to-day to be?" And it was certainly kids. I actually did not love internal medicine either. I don't like adult problems. I don't mind talking to adults about their kids, but I really just knew I wanted to take care of kids. So that was easy to figure that out. And then when I did my residency, I also was in an advocacy based track in that program. So which was like primary care and also like how to kind of change systems and think about advocating for patients, predominantly underserved patients. So I got a lot of great exposure during residency and med school, and training kind of in thinking about systems and systems change work.
Okay, so just carve out the time period that took from when you went to Bryn Mawr
Yeah, so I went
to
to Bryn Mawr.
through these residencies. How
Yeah,
many years
so
are we talking about
so
here?
Bryn Mawr through med school was 6 years, and then residency is
Okay.
another 3, so 9 years.
Okay. So you go through all of that after 9 years, and then you kind of at that point, you enter kind of the traditional healthcare model, or was that part of that healthcare model, that journey, that next kind of phase?
Well, the next thing I pretty much did, well, if I had a baby first at the end of residency, and
Yeah.
but then I started working at the South End Community Health Center. So
Okay. Okay, and how long did you work there? Was that the 15 kinda
that
year
was the
period
15
that
years,
I
yeah, a long time.
Okay, so let's talk about that, okay? Because now you're is it fair to say that, okay, you've gotten the accreditation, you've picked
Yep,
up the knowledge, you've done what you needed to do to get yourself positioned.
yep,
Now you're out in the world,
yeah.
and now it's this process of starting to define, okay, what is it exactly that I'm trying to do? So you start in kind of the traditional healthcare system, and let's talk a little bit about that and
Yeah, and
how
I
that
was,
kind of pointed you in a different direction.
well, I mean, I was very happy being working part-time as a pediatrician at the South End Community Health Center. I loved it. I had wonderful mentors who I'm still very much in touch with, wonderful colleagues. I loved the patients and I loved the mission. And I actually thought I'm sort of like done. This is going to be my career. I'm going to work part-time and be able to spend a lot of time with my kids as well. And that's great. That's what I wanted to do. I'm done.
Right.
I was sort of like,
Settled,
I
right? You got it.
done.
I'm done.
Easy.
Yeah. Okay. Right. Exactly. But you didn't
Um,
settle.
didn't settle. And it wouldn't have been settling. Like it would have been a very like rewarding and wonderful
Right.
career. And I very much thought that that was like I really was so happy in being able to do that work. And then my boss left and he literally
Okay.
put me in charge of the department. And I said, "Well, I don't really want to be in charge of the department." And he said, "Well, you're going to be in charge of the department. You're the only person who can do it.
Tough.
And like, that's the
Right.
way it goes." Basically, like you drew the short stick and good luck. And literally like
Right.
that was it. And so I ran the department as the like interim chief of pediatrics for about a year and a half. And helped to start a school-based health center, which I ran in the Blackstone School in the South End. It was the only full-time school-based health center in an elementary school, and I
Okay.
loved that work. I was
So
still seeing pa
now you're starting to touch on the model a little bit, right?
exactly.
Okay.
I helped bring mental health into helped integrate mental health into the Department of Pediatrics. I advocated and ultimately, but probably not during that time, helped to hire a case manager for our department, but that was a lot of, like took a long time to kind of, you know, basically get people to understand how important that would be. But during that time that I was the interim chief of pediatrics, I kept trying to hire my boss because I was trying to hire the new head of pediatrics because I said didn't want to do this. And but they kept bringing me candidates who, didn't have leadership experience, didn't have experience working with diverse patient populations. And so I would tell them, no, that person's like not good enough, or that person doesn't have enough experience, or they're not the right fit for our department. And so the CEO finally said to me, if you turn away another person, like we can't keep turning away. We have a lot of candidates that keep coming. You keep saying no to everyone. So you're either going to have to take the job or take the next person who we bring to you. Like that's like we're done with this shenanigans, basically. Um, and so by that time, I had realized that like, oh, it's actually like really fun to run a department. It's fun to build teams. It's fun
Right.
to innovate and create programs and be able to say like, oh, I'm going to create this program. I can do that. It also was like a pretty, in some ways, difficult time at the health center financially. So I also got to like kind of protect a lot of staff from sort of what I would call the noise of healthcare, like the finances, the things that weren't working well, and just say, like, you guys are seeing patients, you're doing an awesome job with patients, keep up the good work. And I would sort of like kind of deal with the rest of it. And I really enjoyed that aspect of it too. So I finally decided I said I would take the job, which was good because then I finally got to get paid for it. So I did the job for about a year and a half without getting paid, which I definitely don't recommend.
Right.
And
Sometimes you gotta do what you gotta do, but
yeah,
I hear you. Yeah.
yeah. So then, I had this opportunity to really lead the Department of Pediatrics. And then all of a sudden, the bureaucracy of medicine really became so apparent in everything that we would do. And basically, we were often told to see patients faster, and like a patient every 15 minutes was the goal. And I actually don't believe in a 15-minute visit. I think, like I always tell people
Yeah.
at 15 minutes, I'm at hello with patients. I've learned a lot, but I'm not like, it's not over. And so I started thinking about different models. I thought like I have a long career ahead of me and I want to work for a long time. And so I want to figure out a way to do it in a way that is actually really fulfilling and is not like about sort of fighting a system and is going back to like kind of the basics of medicine, which to me is the patients, right? So how do we put patients first and just take really good care of people? Because I think that's why most people go to med school.
Okay. So this is a great case study. I mean, this is like if I was teaching a case study in school, this is how you would set it up, right? So you find your North Star, you go out and you check the boxes that you need to check to be able to jump into that. You then do jump into that, and in being involved and running and active, you kind of identify three and there are probably more, but I wrote three down, three significant things that were either that went against what you were trying to build or just were operationally inefficient. So the seeing a patient once every 15 minutes, I wrote down, the insanity of the billing cycle, how
Yeah.
people are billed, whether you're spending, half hour with them or 60 minutes, it's all the same thing. And then bureaucracy, right? And the bureaucracy is what kills great ideas, right?
Yeah.
You can have the world's greatest idea, and all of a sudden the bureaucracy wraps around you and drags you to the bottom, and you're never, you
Yeah. You
never
can't get out.
escape, right? Right. Okay, so now you've identified this. You've been at this organization. You have kind of a vision. What did you do next? I mean, you jumped, right?
Yeah.
I mean, that
Well,
was
I mean, I went
okay.
I jumped slowly, right? So I decided
All
like there
right.
has to I always say there has to be a better way. So I
Mhm.
went to figure out what it was. So I talked to people all over the country. I would talk to like anyone I could find that I thought was doing innovative work. I thought about different models, concierge model, something called direct primary care, and I kind of built the business cases for them. I had my very first kind of iteration of Boston Community Pediatrics was a concierge model. So currently about 80% of our patients have mass health as a primary or secondary insurance and 20% have private insurance. And of those, about 10% are barely making ends meet, but about 10% are. And so I thought, well, what if those 10% actually paid like a concierge type fee, annual fee for, and then everyone also paid some fee, but like a very very small fee, like a dollar, $5, $20 a year versus like 3,000 or something, right? Which in
Right.
adult medicine, lots of people are paying for concierge medicine right now. Actually, in pediatrics, most people aren't because most of pediatrics is somewhat concierge. Like you always have to be on call, right? If a kid's sick, you need to talk to someone. And so I don't know that there's as much of a market for it. But anyway, but I thought about this idea and it was going to be I was going to run it as a for-profit business. And I had a pitch and I went and pitched it to someone. I needed capital. So I went to pitch it to someone who could give me
Yep.
capital and they were like, it's not a great idea. And, I like had a PowerPoint presentation. I was all excited. I had like
Oh
tried
yeah.
it out on lots of people and there was
Oh,
going to be like a
I've felt this pain. Yeah.
yeah, there was
I
gonna
know
be
where
this
I know
a
exactly what you
6%
mean.
return. I thought it was like really good, but it's like a double impact investing in my opinion, right? And they were
Yep.
just like, "No, I wouldn't invest in it." So I left the meeting and everyone was like, "Well, are you like so upset?" And I'm like, "No, I'm so happy. Thank God I didn't like try and start something that was not going to work." Right. So I went back to the drawing board and, you know,
Okay, so
yeah.
you what you went down is you went down this double this kind of double-edged model, right? Concierge supporting this other piece, and that's the idea that you took out in the market. The market kinda chewed on it, spit it back out at you and said, "No, it's
Nope.
not exactly what we're looking
Yeah.
for," right? And then you did the smart, in my opinion. I mean, this is, I think, where a lot of entrepreneurs, and you are an entrepreneur, where entrepreneurs tend to fail and make mistakes is they don't listen to that market and they're like, no, this idea is they just don't understand it, right?
Yeah.
But you took the different path, right? You took that information, you went back, you reassessed, and okay, keep
Yeah, and
going.
so I thought, well, okay, if I if I wanted to create like a small private practice, but obviously I'm not going to be able to make if I'm not doing the 15-minute visits and most of my patients have mass health, which it doesn't pay as well as private insurance, I'm not going to there's no like business plan for that, right? The business plan is it doesn't
Right,
work from a business standpoint.
right,
But if I
right.
use philanthropy to as I always say, I use philanthropy as like my venture capital money, right? Like I very much think
Yep.
of this as a business. I think of it as a startup, and that's like my capital to be able to do the work. So if I ask. there's so many nonprofits in Boston that have to raise money every year. There's a lot of wealth in Boston. There's a lot of very generous and philanthropic people. So if I take that,
Yes.
like knowing that that's like the landscape, and if I made it a nonprofit pediatric private practice, so I take all the things that I know and that are great about a private practice, like you call and someone answers the phone, your child's sick, they tell you to come in, all these things that like weren't happening in larger institutions and health centers. Sometimes the health center, they don't even pick up the phone, or they pick it up and tell you there's an appointment in 4 days. If you have a child with a fever, 4 days is not very helpful and you're going to end up in the emergency room, right? So so I thought, well, if I do that and I use philanthropy to make up sort of the delta in what I need to be able to kind of put this model together with 30 to 60-minute visits, with on-site and integrated mental health, with the whole team to help families with the social determinants of health, then I can make it work. So I actually went back to the same person. I went to other people too, but who had said no to my other model. And I said, would you give money to this from a, philanthropic standpoint? And he said, yes.
Wow.
So,
Isn't that interesting? So he said no as an investor and yes as a philanthropist.
yep,
Crazy. Okay.
yep.
All right. So now you've got the model
So I have the
and,
model.
and you have the financing structure that
I have
you
the
think
structure, but I
is
don't
gonna work.
have the financing, right? So I have
Right.
this idea. I've I've established an entity. It's 2019. I'm still working full time at my other job, but I'm doing all of this work on my own time, nights, weekends,
Right.
anytime I
Right.
could. I've I've set up a company, so called Boston Community Pediatrics Inc. And I have applied for my 501(c)(3). I have approached board members, so I've created a very like small but mighty board. And I'm trying to figure out, I can't like, it's like kind of what comes first, the chicken or the egg, right? Like I can't raise money without my 501(c)(3), but I can't keep doing anything if I can't raise money, right? So I'm like kind of
Right.
stuck in
Right.
this, like, what do I do now? So
Yeah.
I'm thinking about,
Purgatory or waiting. Right.
yes.
Yep.
And as you can probably tell, I don't really like to wait. It's not my style. So I'm looking at fiscal sponsorships, and I get this call saying from I had started working with in a accounting and practice management firm, and they said don't go with a fiscal sponsorship, we just got your 501(c)(3) status. And I was like, yes.
Oh, perfect.
Yeah,
Yeah.
so now
Right.
now I can start raising money. So we start doing that. Actually, I had a meeting in the fall of 2019 with the Shaw Family Foundation, and
Yeah.
I had again, my PowerPoint pitch. This time I had it not on the computer, but printed, and I clearly remember I went to Staples to print it on nicer paper because I thought, well, like this is like a pitch meeting. I think I should have it on nicer paper. And I brought it to the meeting, and I left the meeting. And they said, we're going to give you $100,000 a year for 3 years. And I was like, okay, we're going, it's starting. And so I was slowly trying to raise money. I had my first board meeting in January of 2020.
There you
And
go.
now we're
We
in
all know
March.
where this is going.
Yep. I had, someone had a small breakfast for me in 2020 to help raise awareness and funds. March of 2020, I have a small group of potential donors at a meeting, or like a pitch meeting with, and there's a lot of wealth in the, like, if people bought into it, I could probably get this off the ground, right? And it's literally March of 2020, and it happened to be the day before the world shut down. And so we went ahead
Wow.
and had the event. People were nervous. We weren't sure whether we should have it, shouldn't have it. We had it. But the next day, it was all over. Schools were out. It
Mhm.
was done. And I also had to go on the front lines at the health center because I needed to
Yeah.
run the
It's
COVID
COVID.
response there,
Right.
right? And
Right.
I'm the head of pediatrics, and so I wanted to be the only person who was potentially treating COVID positive patients because I had young pediatricians I didn't want to put at risk. I had older pediatricians I didn't want to put at risk, and I was going to be there every day, so it's fine. So I
Okay,
can't
so
even. Yeah,
you still have one foot in the health center
yeah,
and COVID hits, so it's obviously gonna pull a
yeah.
lot of your time and
All of my
focus
time.
back towards all of your time and focus back to
Yeah.
supporting that and kind of working through that. So did you put the idea on ice?
Yep,
Meaning just
totally,
stop?
totally. I was like,
Okay.
this, like, in my career, I had never worked or been involved in anything like this. I mean, I don't think any of us had,
Right.
right? Like the
None of
entire
us had,
world
right.
shut down, and the only thing people needed healthcare, right? Like kids still needed to be
Right.
taken care of, and we had to find all these new and innovative ways to do it, right? So we got like a tent and put it out on a deck so that we could test people outside because it was safer to be outside. We had to get food. Our families, within 2 weeks, they were starving. They had no food, they had no diapers, they had no formula. We had to figure out how to get all of that. I would literally come home from work every day and tell my kids to get in the car, and we go to Target and we'd buy stuff. I was actually raising money on the side to buy stuff for families because we had to help people. Like it was,
Right.
and it was very scary. I would leave for work and my husband would say, like, I hope you come home healthy, and if you don't come home healthy, should I let you in the house? Like, you know, I mean, he was like, look, you'll
Right.
probably be fine. I'm like a 50-year-old guy. I'm not going to do well. It
Right.
was, it
Right.
was a very, very scary time. And it was a really, in many ways, the people who were working in healthcare, it was an opportunity for people to really come together and join forces and, do something to really help people.
So you're fighting through this in March of 2020. It's kinda I remember it's a day at a time, right?
Yep.
It's like people need help, just trying to kind of fill the gaps, right? Fill the
Yep.
holes that are being created. Then, the George Floyd murder happens.
Yep.
This whole social aspect gets overlaid on top of the medical aspect. I mean, it was really a incredible year if you think
Yep.
about it, from these massive societal cataclysmic things that are all just like cascading on top of one another.
Yeah.
So just walk me through. Okay, so all this is going on,
Right.
and then you kind of get to the fall. But I mean, can you just wrap in how all these things kind of
Yeah.
coalesced around you, then coming
Yeah.
back to the BCP?
So I think one thing that was really interesting is that the healthcare disparities, which for those of us who had been working in health centers and hospitals taking care of patients with low income, sort of knew about these disparities, right? Like this was sort of our everyday life. And it's why many people have chosen to work in those areas. But now all of a sudden in COVID, everyone knows that there's disparities, right? Like there was tons of
Right.
data that came out around like Latinx patients who were getting sicker from COVID, Black patients who were getting sicker from COVID, who were being, affected differently. And
Yes.
so all of a sudden, the disparities that were something that I had always been working towards eliminating, now all of a sudden we're like in the forefront, right? So my
Yes.
tagline, bringing equity to pediatric healthcare, is now making a little bit more sense to people. But again, on the back burner, in when the George Floyd murder happened and all of the racial reckoning that came with that, COVID actually had calmed down a little bit. It was still very much
Right.
a part of everything, but we had systems in place. People weren't dying every day anymore. There was
Right.
promise of a vaccine. Like there were things happening, and I I was like, okay, my tagline is bringing equity to be pediatric healthcare. If I do not use this like if this moment doesn't spur me to go and start this organization now, then I'm probably not going to start it. Like, and it
Right.
very much felt like, shit or get off the
Well,
pot.
that's right there's the catalyst, right? I mean,
Yeah.
in the middle of the chaos, the catalyst emerges. So November of 2020 is when you started, correct?
Yeah. But even prior to that, so I was
Uh,
like, well, I had already found real estate before March of 2020. I was like, okay, now it's
Okay.
June. I'm like, okay, I'm going back to the real estate. And then I had said, well, in order to sign a lease, I probably should have some money in the bank. And I said, I think $500,000 sounds like a good amount of money. Luckily, my board said, yeah, that sounds like a good amount of money. And I had raised about 499,999, and it was August of
Mhm.
2020. And I thought, well, I'm at my goal. I'm going to sign the lease. So I signed a lease. We started building out the space because I also realized it's very hard to raise money for something that doesn't exist, right? Like, oh, there's no, it's a concept. And
Tell me about it.
yeah, right. So like
It
I knew
is, it's hard.
yeah,
Yeah.
I needed a physical space. I needed to like keep pushing forward to be able to kind of continue to raise money and continue to get momentum. So now, so it's towards the end of August 2020, I tell the builder who's also my landlord, I want to I would and he was amazing. He allowed me to roll the sort of the build out into my 15-year lease, so I didn't have to raise extra capital for that. So I'm like, okay, I want to open in November. So let's get going. So, because we had to create a whole brand new space, like there was nothing about, we really took it all down to like the studs and restarted.
Right, right.
And so I gave my notice that I was leaving at the health center, like everything's in motion now to get us to November.
Okay.
Yeah. Actually, November
Okay,
16th.
so
So,
November 16th is the day.
yeah.
I mean, that's it well, 5-year anniversary then,
5 years ago.
correct?
Yeah.
Okay, okay, unbelievable. So it begins, and you commit full time, and you start to grow your practice.
Yep.
You know, you have and now you're doing multiple things, right? So you're growing your practice, you're seeing patients, you're administering and running the business, and now you've turned into, a fundraiser. And I'm
Yep.
assuming that, fundraising, if it's at like fundraising that I know, it's like a 24/7,
Yeah.
365 day a year job,
Yeah.
right? There's
Yeah.
just a piece of your day that always kind of revolves around that. Um, I think what struck me, I was looking at the agenda from this last gala that you did, and the uh, the network of support that you have amassed is pretty incredible. I mean, kind of crossing variety of different industries, a lot of finance people, but a lot of other businesses in there. I mean, that's a lot of work.
Yeah.
Any thoughts or people are listening to this? I mean,
Yeah.
how, getting that you're at the place where kind of everybody wants to be. Now you've got, benefactors, people coming back. They've included you. You're getting these annual grants coming in. The gala's successful. How'd you get there?
Like a lot of hard work, you know,
Yeah,
and
right.
and just literally like putting one foot in front of the other. And I would say like leaving no stone unturned. I will talk to anyone at any time, anywhere, and just like showing up. And I think like just kind of being very like genuine and focused in what the goals are.
Right.
It's funny. I always tell people like I never have prepare for a fundraising pitch. I mean, that's not to say I don't like look at what I'm going to say and stuff, but like a lot of times people come to our
Right.
office and I just walk around and talk about my day,
Welcome to
right?
Show in
Or
the
like
Office. Right.
this is what happened yesterday. Oh my gosh. Oh, let me tell you about this patient. Let me tell you about how we helped this patient. Oh my God, there's the patient I was talking about, right? Or it's all like so authentic, and there's no like I don't have to be like, "Oh, tell me what happened," because I'm doing the work day in and day out. So I don't have to talk to anyone to find out what's going on, if that makes sense.
Right, right. Yeah. So how many employees do you have right now? How many people are
Yeah,
working
so
there
we
full time?
have 22 employees. We started with
Okay.
8 so November of 2020, we had 8 employees, 150 patients. We now have 22 employees and almost 1,700 patients.
Incredible.
So,
Incredible.
so we've grown quite a bit and we've doubled our
Okay,
space
so
too.
yeah, right, right. So I mean now this thing is standalone, meaningful, growing, super impactful in the community. And then two things happen. And this is just so symptomatic of starting something, right? It's and I always tell people this. They're like, "So do you enjoy what you do?" And I my answer is I love what I do. I enjoy to get up every day, right? But it is challenging, right? It is this roller coaster, and I don't think there's any way that you can avoid it. So, like, if you're trying to start something, just prepare yourself for the fact that you're gonna
Yeah.
wake up one day and say, "I got this," and everything's perfect, and then things get thrown into
Right.
chaos
In
again.
one
And
second,
so,
they could blow up. Yes.
1 second, right? So you
Yeah.
get through all the social upheavals, you get through COVID, you get through the fundraising, you get these things going, and then all of a sudden, federal government starts pulling grants away, right? You know, the immigration issues, and we haven't talked about this, but
Yeah.
it just I can't imagine that this has not impacted you and your organization. I'm
Yeah.
sure the government grant situation has impacted your organization. I've I've talked to a few people on this podcast, and I've talked to a lot of people outside of the podcast because, obviously specific to the government shutdown piece, there's a lot of trepidation in the market. There's a lot of
Yeah.
nonprofits that are wringing their hands and concerned. And I keep telling them, listen, it's changing. The world changes, right? This is
Yeah.
change, and you have to adapt and you have to innovate around that change. You can't, wishing that it didn't happen isn't going to help you, right?
No.
You have to figure out how to adjust to that. So tell me a little bit about what these new kind of monkey wrenches that have been thrown into the
Yeah.
well-oiled machine have done and how you've been kind of thinking about your business model as it relates to the, environment we're in right now.
Well, I think starting an organization in the middle of COVID teaches you a lot about adapting to change
Resilience, right? Yes,
and also, being laser focused on the work that you're doing and not letting sort of the external forces um I mean, obviously they affect it, but not letting them sort of impact how you go about your business, right? And so I
yes,
think I actually feel like because that's when I started, I like already started out sort of like knowing that like every day could change, every day could bring something new, especially around the COVID vaccines. Like we were one of the first and only actually pediatric private practices to offer the COVID vaccine, not only for our patients, but also for families and parents in the community. So, like, we vaccinated the UPS guy who delivers to us. We actually vaccinated the mail carrier because you couldn't it was hard to find at times, but it
right,
it felt so important to me. And so but there was always change happening, or something was going to be different. We always
right.
had to like be thinking like one step ahead, but not necessarily knowing exactly what one step ahead meant, if that makes sense.
Yeah. No, yeah, it does. It's just trying to predict these things and getting yourself in front of knowing that the change is coming and trying to figure out what you're gonna do is,
Yeah.
a big part of this for sure.
So I think today, like, I think those days prepared me and the organization so well for today, right? So I always knew that regardless of what the environment was going to be, you have to have money in the bank. So this idea that like nonprofits are supposed to like balance their budget to zero is
Mm,
very silly to me, because no business
right,
and no person would ever want their budget balanced to zero, right? So,
right.
I run this very much like a startup and very much like a business, as it is a business. And and then I always say that, like, anything I don't know, I know someone who knows it, right? I can find like, I love working with really smart people. I love finding really smart people to help us. And so last November, when there was a lot of foreshadowing about what was going to come,
Coming. Yep.
and so I immediately went and talked to some legal services agencies, and I got us an immigration lawyer, right? So someone who
Smart.
could come. We partner with a legal organization to have a lawyer on site twice a month to support our staff, to support patients, because I knew and know that we do have a number of undocumented families here, and that we
Yeah.
needed to be able to support them. And so, but that legal expertise is not our, we're healthcare experts, not legal
Right.
experts. But if you need legal advice, it's going to impact your health potentially. So, right. So we bring the lawyer on site. I also knew that potentially federal funding was going to get cut, and we had two federal grants. And so I said, well, we better be prepared for when that happens. And sure enough, earlier this year, I got an email on a Wednesday morning around 9 a.m. saying your grant's over. Last invoice is due at noon, by noon today. And then actually later that day, the email said, actually it ended Monday, not today. I'm like, okay, great, whatever. So we were prepared, right? So
Right.
we
Don't
had,
bother sending anything in. Right.
yeah.
Right.
And, I
But
think just,
you were prepared.
mhm, we're prepared and we're able to adapt. Like when you take out all the bureaucracy, you just do what's right. So like when the government shut
Right.
down, and that we knew that SNAP funding was likely going to be affected, we had a whole plan in place. So when it really happened and people could not get their SNAP on November 1st, that was a Saturday. On November 3rd, Monday, I had so much food in our office. I had gift cards ready to go. We had a whole plan in place that day, because you can't spend a month thinking about things and then trying to put something in place. Like, if you did that, like for instance, now things are a little bit better on that front, but there's still, there are still going to be cuts and there's still going to be changes. And so we have to be so focused on our work, which is taking care of patients and centering the patient. And I tell our staff, I'm like, there's a lot of noise, right? And
Hmm.
like, you let me worry about the noise, you worry about the work, and I will take care of the noise. I mean, I can't obviously change our government, but I can change how it affects the way we provide care. And one of the things that I have always felt, that healthcare really operates often in a scarcity culture, and like, that's not a way to operate a business where you're taking care of people's lives, right? You need to
Right.
say, okay, we are going to do whatever we can to support families. And I always tell our staff, like, there's almost nothing else I no to, right? If it's a good idea and it's going to support patients and you can justify it, I'm probably going to say yes. And so, someone might come to me and say, we had this idea, this happened. We wanted to do a Halloween event. We know you're never going to allow candy in this office, so we are going to make it we're going to pair it with a reading event. So we're going to call it Halloween Reads, and we're going to bring kids in for a reading program and let the kids dress up and make it a really fun event. Can we do that? Sure. Like, that's amazing, right? And then we just make everything bigger and better, right? So the next year we decide that we're going to have Halloween costumes available for kids, and so we'll do it enough ahead of time so that if a kid need a Halloween costume, we can help them with that. But it's
Well, it's amazing because just listening to you, it's incredible because if you read, the healthcare system in the United States is broken, and it's this massive bureaucratic nightmare of trying to navigate, find funds, etc. And lo and behold, the way that you solve that is you put innovative and visionary people in charge of one aspect of it, and you say, go out and solve this problem, right? Take it out of government,
yeah.
put it in the private sector, and let smart people go out and figure out what the solution is to it. I mean, how many pediatric practices in the United States have an immigration attorney, on premises and are ahead of the SNAP crisis that was developing. I mean, that is just like that is innovation and execution at its finest. And, I just hope that, as we kind of navigate through this, that, the example that you're setting, you know, not only in Boston, but this is just such a great example for anybody who's like trying to stand any of these things up and running into all of these issues and thinking through them and innovating around them, surrounding yourself with smart people, thinking outside of the box. It's just really, really impressive what you've put together. So my last question on this before we wrap it up on the other piece is where do you see all of this? I mean, so, the government shuts down over healthcare, right? And we all just scratch our heads because everyone in Washington is just screeching at one another. And as usual, nothing really gets done. And it's all animosity and vitriol, et cetera. And there's no action. And yet the healthcare system is as broken as it ever has been. It's as
Yeah.
in a way, way too expensive. Way too few people can access it. But in this one little corner of Boston, right, a solution has been found. So what do you like 10 years from now, not just for BCP, but where do you envision kind of things? Now you're on the front lines of all of this, right? Where
Yeah.
where do you see things going in the next decade?
Well, my very glass half full outlook is
Yeah.
that when the healthcare system crumbles, which unfortunately I think it might over the next couple of years, that when we build it back up, we actually do the things that we know work. So we invest in prevention, we invest in primary care. Like right now, this was some of what I talked about at our event. Like the US spends $5 trillion a year on healthcare. That's $14,000 per person a year. A whole year of care for one child at BCP is under $3,000. Like it is very, very inexpensive. And that includes your health care, that includes your backpack for school, your holiday gifts, your Thanksgiving turkey. We're giving out, next week we're giving out 350 turkeys, sides, pies, shelf stable food,
Mm.
produce, winter coats, like everything that you need for Thanksgiving. So if you couldn't go to the store, you don't just have like the turkey. No one just wants a turkey. You need everything. And so it's this like that includes hygiene products and clothing at every visit and food at every visit. It's a very holistic view. And I think when you do it right and you do it well and you take out bureaucracy, it's actually inexpensive too. That's the other thing is you save money, right? And when we help families.
$14,000 per person in the United States.
Mhm.
I mean, as scary as blowing it up sounds, right? It feels to me like it absolutely needs to be blown up and rebuilt,
Right.
and just start over, put smart people in charge,
Yeah.
let capitalism fill the void and, get back to something that I mean, how do you even count to 5 trillion? I mean, it's a
I don't even
ridiculous
know
number.
I mean, I say it and I'm like, I don't even know what that means, but it's
Right.
a lot of money, how about that? But I could
Right.
do a lot with
Exactly.
that in pediatrics. But anyway, so, I think if we start and only 5% of that is on primary care. And it needs
Right.
to be more. We know that. I mean, pretty soon no one's going to have a primary care doctor because they're not going to exist because we're not investing in it. And so our goal is to expand BCP as much as possible. I announced that we're going to open 2 to 3 new sites in the next 5 years, but I would like for there to be even more I hope that this model just like takes off, not just in the pediatric world but in the adult world and in women's health and in every world, because I think it's the right way to deliver care, which is starting with the patient.
Well, I mean, it can't be right because it sounds too logical. I mean, I'm being
I know.
facetious, right? It is absolutely the right way to go, and you are onto something, and you're one of these Boston companies. I'm gonna walk down that. I'm gonna walk down that that terminal at Logan Airport. I think it's in Delta Terminal where they've got all those companies that are up on the wall. And this company, BCP, is going to show up there as, a company in Boston that was really reinventing how healthcare should be done for, and specifically for some of the most needy, groups in the city. So you're just doing phenomenal work. All right. Well, this has been a phenomenal hour of discussion, and I really appreciate you taking the time. One of the things I like to do at the end is what I call the lightning round. So I got a couple of questions for you, and then we'll call it a day. All right. Does that work for you?
Okay, sounds good. Yeah.
What's your favorite quote?
Be brave, not perfect.
Love it. Do you know who that's attributed to? Or is it a
I
Givinga or
actually
Robyn
don't know
Riseberg?
who said it. No.
All right. I love it. Be brave, not
No,
perfect.
it's not. I don't know who said it, but yeah.
Yeah, I love it. Favorite book?
Mm. I love Michelle Obama's book, Becoming.
How do you recharge? What do you do outside of BCP?
Well, I love Barry's boot camp, so I can often be found there early in the morning, and I also love spending time with my family and friends.
Awesome, awesome. And one piece of advice. So, what would you tell someone who wants to make a meaningful impact in healthcare? Is listening to this and it's resonating with them. What would you tell them to think about as they're
Just
pursuing it?
real I mean, I think, like, think outside the box and go back to, like, the basics. Think about, new and innovative ways that maybe step outside the system. That's one of the things that we really do here is we said the system isn't working, so we're going to do something different. And I think a lot of people are so focused on trying to innovate within the system or fix something in the system, and sometimes you have to step outside the system to really make a change.
What you've built there is incredible. It's so impressive. How can how can people contact you if they want to become more involved? What's the best way to interact with you?
Well, we have our website, which is just www.bostoncommunitypediatrics.org. We have Instagram, I have LinkedIn, like, I'm pretty much on everything all the time. And I think half the city has my cell phone, so I'm always happy to be contacted.
We need to get the other half of the city with your cell phone as well.
Yeah, yeah.
Well, this has been a phenomenal discussion. I know you're super busy, and I really appreciate you taking the time out to talk with us. And I'm just so impressed with what you put together down there. Congratulations on all your success. Wish you the best as you move forward, and I'm going to be actively watching as this thing continues to grow. You're a beacon of light in Boston, and you're gonna continue to show incredible impact here. So thank you very much for taking time to join us today.
Yeah, thanks so much. I really appreciate it. It's been really fun being here.